And welcome back to Health View. Again, this is Dr. Angela Ruff, and our guest this morning is Dr. Yvette Stokes, who is the owner of Highland Pediatric Dental. And again, if you have questions for Dr. Stokes, her email address is firstsmilesYMS@AOL, and their office number is 910-485-8749. Well, Dr. Stokes, during the break, we were talking a little bit about what your feelings were about tooth-colored fillings versus silver fillings. I know there's seems to be always this controversy in the news about, mercury in fillings and things like that. So maybe you can just kind of expand on that a bit.
Well, I am not convinced that there's enough mercury in amalgam in a couple of fillings to cause some of the drastic problems that have been reported. Mm-hmm. I'm a slight skeptic on that, but in children often brush their teeth or they grind their teeth. It is a very common complaint of parents. And I have found, since I have been using white colored fillings, the composites, that those materials wear much better in the primary dentition. And when I say wear, as kids are grinding, they sort of grind the filling down as they grind their tooth down. Mm-hmm. In amalgams, we found that much more often an amalgam is going to crack. It's going to break as you're grinding your teeth. Therefore,
because the nerve in the baby teeth are much higher.
They're very high. They're very, very superficial. Mm-hmm. And so when you crack those fillings and you get decay, then you're much more likely to get more caries and caries down into the nerve of the tooth. You may run a bit higher risk of ending up with a crown on those baby teeth. Mm-hmm. I'm very, very pleased with the composite or the white fillings and the wear that I get and the few that I have to replace over time.
Because as it wears down, it's adhesive, so it actually sticks to the tooth.
It sticks to the tooth. The tooth and the filling sort of wear at the same rate, and so you notice nothing except the tooth that appears to be getting a little bit smaller, a little bit shorter, and it just all wears the same. And I'm very pleased with the composite fillings, and it looks good. You know, this is a very aesthetic conscious community that we have, and just as you and I want to look better and we want to look very good, the parents want their children to look very good, and they prefer not to have the silver fillings, most of them.
Right.
When we have to cover a tooth with a stainless steel crown, then we have to. But if we don't have, and we have some small fillings, then we much prefer those to be white fillings.
Right. I actually had one of my dental employees. Kids had, one of his friends had that stainless steel crowns on his teeth, and he came back and says, "Mom, I want to get silver crowns on my teeth too." She's like, "No, you don't.
No, you don't.
Keep your own teeth. That's no excuse for you not to get to brush your teeth tonight."
That's right.
So, anyways, but I think the tooth color fillings are great because I think oftentimes you can't tell that there's.
You can't tell they're there. Exactly.
In fact, I did an exam on one of your patients who you did some tooth color fillings on the child, and so they were just getting their teeth cleaned here. And I, unless my hygienist had told me that these teeth had fillings, I didn't see them, and I had magnifying glasses on.
Exactly. Yeah. It's a great service. Great service.
Yeah. So that is nice. So I guess are you guys kind of sworn to secrecy that their kid never had a cavity then?
No, we don't do that. We we tell the parent, you're here, we're taking care of those problems now, and then you're cavity free, and we just kind of make that a big deal once they're cavity free.
Yeah. Okay. Well, who knows what the parent says at the PTA meeting?
Who knows?
Oh, my kid never had a cavity. Look at her teeth. So other than the but if push comes to shove, you would do a silver filling if the parent preferred that.
Yes.
But tooth color, obviously, most people kind of want it to look like white teeth.
Yes.
So you were talking a little bit during the break about the child that was in the news recently that had died from a dental abscess.
Yes.
Maybe we can talk a little bit about that.
Dental infections in children can spread very rapidly. When we have a child that has a dental infection, sometimes they come into the office, and if it has been there for quite a while, we have infections on top teeth that have eyes that are almost closed shut from an infection. We have abscesses on bottom teeth, and they have large knots, large swellings under their neck. Many, many years ago, people died from dental infections. They died from dental infection because they were not treated. You could not handle the bacteria. You would get something called Ludwig's disease. And you know, when you get the swelling under your throat, that goes around your neck, and it can actually cross the midline, and you can die from a dental infection.
Right.
I think the young man in Chicago, I believe, an 8-year-old little boy that died, he died. I think he had an infection that actually spread to his brain. That doesn't happen every day, but that is very, very realistic. And it can happen probably more easily in a child because their bodies can't handle this and can't fight this off maybe as easily as an adult can. So we often see children that we have to send over to the peds emergency and have them admitted to the hospital so they can go on IV antibiotics because when you have a swelling so intense that it's closing your eye, that's very, very serious, and that's not something that, in my opinion, needs to be treated at home with oral antibiotics. You know, it can be so dangerous. You can lose an eye. You can get a brain abscess, and it's not anything to be taken lightly.
Right.
And the young man in Chicago he didn't have dental care, and had an infection that just spread and took over his body, and he ended up with a brain abscess, I believe, and died. And that's very, very unfortunate for something that can be treatable. It can be treated. It can be taken care of. When you have those infections, those kids, their little jaws swell up. I very often don't give antibiotics in my office. If you come in and you're having pain, my treatment is to take care of that, whether it be to take a tooth out or whatever the treatment is. We very rarely just give antibiotics and say, I'll come back in a week or two, because we don't know if we're going to see that child again.
Right.
We don't know. And if the child is already in that bad of a predicament, we want that child taken care of.
Right.
And we don't like sending that child home.
Yeah, because, we talked earlier where a lot of times the parent won't bring them back.
They won't bring them back because the pain is gone.
Yeah.
Once you give antibiotics take care of the swelling. Once the swelling goes away or it goes down, the swelling is typically the source of pain. Once that swelling goes away, then the pain goes away. Everything feels better. They think the abscess is gone, but it's not gone. You've just made it a little bit smaller.
Yeah. Right.
You've bought yourself a little bit of time. And I much prefer to take care of a child and know that I have removed the source of infection. The abscess has not gone until the source of infection has been taken care of.
Right.
Whether that tooth is out or you've removed the pulp that has been infected, and that's what I prefer to do.
I know we tell our adult patients when they come in emergency, and if we put them on an antibiotic, we're like, now we haven't healed you.
Exactly.
This
Exactly.
will come back.
It will come back.
And it may come back worse.
It may come back with a vengeance.
Yeah.
Exactly.
So we try to emphasize that, and most people believe us. But,
they do. They do. We seem to get very graphic when we see a child that's in that much danger. We get very graphic, and we tell them the worst scenario, because we want them to be afraid. If I see a child like that, I want you to be afraid. And oftentimes, if I have to admit a patient to the hospital, I tell the physician, when you release this patient, you release this patient to me. I will come in my office, whether it be Friday, Saturday, or Sunday, and take care of that patient when you release them, because I just think it's that serious. And that doesn't happen often. But when it does happen, I just think it warrants a little extra attention.
Right. Well, you're a good woman, and now you guys remember that she's got 4 kids. Well, okay, 2 are grown, waiting for a home when she goes in to do that.
That's right. That's right.
Lots of gold stars in her halo there. We could talk, a little bit about, there's Medicaid. There's also another, is it
Health Choice?
Health Choice, yeah. So that there are avenues out there to help kids to get dental care. I know you've had this in your office, but something that's been frustrating for us is, boy, they have this great state-funded insurance that will help them get care, and they don't show up.
Right.
And it's not the kid's fault.
So I think it is very frustrating because, Medicaid is a great service. And, I wholeheartedly believe in it. There are people who need some help. They need help every now and then. Mm-hmm. And I think it's a great service. And it's a wonderful way to have your child taken care of. But I think people need to take advantage of that more often. Mm-hmm. When I say take advantage, if that is available to you, then make sure that your child is receiving the absolute best care that they can get. And they can get wonderful care,
sure.
Have all those teeth taken care of, mm-hmm. and be cavity free.
Right.
And you just have to show up and have the treatment done.
Right.
And we have a wonderful Medicaid population of patients in our practice. I think once people know that you're there to take care of them, you really care about them. We have patients that have been there for, all of their childhood lives. They're graduating from high school, leaving. Mm-hmm. Some of them are still in college.
Yeah.
And they've been, accessing that care, mm-hmm.
just
as anyone else would for years. And we just need more people to realize that the care is there and be very, very responsible about taking mm-hmm. care of those children and coming in.
Right. One of your patients actually is a good friend of one of my dental assistants, and she said she was taking her child in to see you, and out walked this fellow who's, I don't know, he's 19 or 20. She said, "Hey, what are you doing here?" He says, "Man, this is where I've always been ever since I was, before school, Yeah. He said, "I love it here. It's great."
We have this joke in our office that we have to kick patients out when they've graduated from college. Right. We will see
I think he's taking night courses. He's
just so he can keep coming to the dentist.
That's right.
What it is.
He heard that rule. He's like, "I'm still taking classes."
And we will continue to see you as long as you're in school, because that's a very difficult time to transition to a general dentist.
Yeah.
And if we try to transition them when they leave high school, we find that they don't seek a dentist while they're in college.
Well, I thought that was a pretty good compliment to you.
Yes,
that
exactly.
Here, obviously this kid had some work done when he was a very young youngster, and he loved it so much he kept on wanting to come back. So obviously he didn't create a dental phobic.
Well, it's a very personal thing when someone is taking care of you for that many years. You really learn that people care about you, and our patients care about us the same way that we care about them. And it's a very personal relationship, and it's hard if you've been going to the dentist somewhere for 18 years. You can imagine it's very hard to leave.
Yeah, I was really sad when my OBGYN retired. I was like,
yes.
So you're 92. Come on. Don't retire.
Exactly.
Keep seeing me, please. So, oh well. But, well, that's you've given us some really great information. We've talked a lot about the age of kids starting the treatment, age 1, to find a dental home. So hopefully you can help them learn some preventive things they can do. Talked about the sippy cups and bottles in nursing and how to avoid, hopefully, rampant decay when they're young. And silver fillings versus tooth-colored fillings. That alloy is safe, but boy, that tooth-colored filling really works great and looks good too.
Yes.
And gives you, quote, lying rights at the PTA meeting. And then, how to really, an infection in kids can lead to very serious and dire consequences. That one kid that actually died of a dental abscess. So don't wait till your kid is just in dire straits and has a huge swollen face before you call the doc. Mm-hmm. So call her sooner than that. So again, if you guys have more questions for Dr. Stokes, then you could email her at firstsmilesYMS@AOL, and their office number is 910-485-8749. And again, their location is at Highland Pediatric Dental on Metro Medical Drive. So thank you for coming out and joining us and giving us all this great information to take home and help our kids out with. And so maybe we'll have you come back again later if it wasn't too painful for you.
Okay. Thank you very much.
All right. You're listening to News Talk 640 WFNC. This is Dr. Angela Ruff.